Okay, so this is chapter 1 and 2. I'm going to give you important hints you need to know. I'm also going to be uploading a video with the entire lecture information. A lot of it is for your information, but I'll upload it so that you can go to it and it'll be an app. Um, so this will be it, and I hope everybody's doing fine. So chapter 1 focuses a lot about patient care and care of the patient in a long-term care facility. So with chapter 1, what's important for you to know are the definition of hospice care. Now, know that hospice care is generally for people who will die in 6 months or less. So that's basically what chapter 1 is about. It focuses on telling you about how to care for a person in hospice care. If someone is in the dying process and you're the nurse assistant, your role is to clean the patient and make sure they're comfortable. They also want you to understand in long-term care facilities, we used to call it nursing homes, and at times I'm still using the word nursing home, but the word they like to use is long-term care because the patient doesn't have to permanently stay there. Some will, some won't because they have rights. The residents, which we call patients that reside in long-term care facility residents, they have rights to come and go as they please. Of course, it's within their care plan. So in chapter 1, you will learn that in order to be in a long-term care facility, you have to have a doctor's order, and the condition to be in a long-term care facility must be chronic. Chronic meaning long-term and require care. Because the state wants to make sure that the elders aren't abused, they set certain stipulations. Working in a long-term care facility as a nurse aide, they want you to be knowledgeable of your facility and of their policies and procedures. Every facility has a policy or way of doing something. And then every facility will orientate you in your first 90 days on the policies and procedures. So it's important to know that a policy is a rule or regulation written down or a protocol. And the procedures, you actually following the rule, regulation, or protocol. When you work in a long-term care facility, you're going to work with a variety of patients. What's important to know is that you want to allow the patient to do as much for themselves as possible. Long-term care facilities are set up differently. You have dementia units that they may call memory care units. You have rehab units. So in every instance, in every situation that you're working on, please allow the patient to do as much for themselves as possible because you're there to promote health. You're there to promote well-being. You're there to promote self-determination and personal choices. In a long-term care facility, we want you to know that when the patient comes there, they have a right to ask about how the facility is set up, what their rights are, and they have the same rights as you and I. But the patient will be assigned to that facility by a physician. So the physician is actually the top person in the healthcare industry. So a physician has to give an order that they need to be there. So when we work in a long-term care facility, you as a nurse aide, if you see anything wrong with your patient, you report to the nurse. The nurse has to report to a physician. There's a chain of command that you'll have to follow, and your book has it in chapter 1 and 2, 3 and 4. So review that. So in the long-term care facility as a nurse aide, your care plan for your patients will be set up by a care team. But you as a nurse aide, you follow that care plan, and also you also have to follow directions of a licensed nurse. In a lot of long-term care facilities, nurse assistants are able to work as therapy aides. So a physical therapist can also give you an assignment because they are a licensed person. But another nurse assistant can't give you an assignment. A dietitian can't give you an assignment. The resident's family, they give you suggestions, but they can't assign you to do anything. Or a physician. The physician can't, but they can give you a suggestion. So the physician, the family, or a dietary person come and ask you to sit Mrs. Jones up to eat, you say, okay, give me a second. I'm going to ask her nurse. Or give me a second, I'll ask her therapist to see if she's able to sit up and eat. You are a part of the care team, and so is the resident. The care team revolves around the resident's, his and her condition and treatment and their progress. So everything is set up individually around the resident. The nurse assistant should only perform tasks that's in the care plan. So if it's not on the resident's care plan, it's not written down for that resident, do not perform the task. Mrs. Jones may want to get up and get out of bed, but if it's not in her care plan, it is not ordered by her doctor, she cannot do it. You will tell the nurse and have the nurse explain to Mrs. Jones why she can't. Residents have the rights to visits. They have the right to have their mail unopened. They have the right to refuse care. They have the right to accept care. They have the same rights that you and I have. And you have to honor and respect those residents' rights when working in a long-term care facility. We will update the care plan because say things change. You come to me because you're on the care team and say, Mrs. Jones has in her care plan that she has to go from bed to wheelchair. But therapy has been working with her, and I noticed that she was able to go from bed to chair. Well, then the nurse and the therapist will go in at her bedside and see, give her a test to see if she can do it, and then they will update the care plan. But as a nurse assistant, you're the eyes and ears of the healthcare profession. Your observations are important and they matter. So make sure you report any changes, positive or negative, in the condition of your residents. We help residents with their toileting needs. We help net residents with showers. We help residents do a whole lot of things in long-term care, and we report to the nurse, positive and negative, to update their care plan. As a nurse assistant, you want to be professional. You want to keep resident information confidential. You want to show up to work in your uniform that your facility has designated. And you want to show up with your body covered. You want to show up professional. You want to show up using the proper personal protective equipment, which are your gloves, masks, gowns, PPE. You want to show up professional and you want to conduct yourself that way in long term care. Residents will argue and curse with you, but you don't argue and curse with them. And if you get so upset, go talk to the nurse. Go talk to someone professionally, but conduct yourself in a professional manner. No yarning, screaming, and farting and acting up. Okay, this is their home. You respect it. Make sure you're covered. Make sure everything you do that you're not exposed and that you're dressed properly. I shouldn't see the veins on your behind in your uniform. You should wear your uniform with pride and respect. Working in a long-term care facility, make sure you keep all residents, staff, and facility information confidential because we follow things called HIPAA, Health Information Portability and Accountability Act. You are required to keep things confidential. What happens in the nursing home stays in the nursing home. When caring for Mrs. Jones, one important thing to do is once you finish the care, once you've given the bath, make sure you document, meaning write it down, record it, computer or paper accurately. Check your facility's policy and procedure and make sure you are able to do that. When working in long-term care, there are people that help the residents, help them with their rights and understanding. And a person that will help them is an ombudsman. An ombudsman is spelled Ombudsman, is an advocate, a state advocate for the resident, not for you, not for the facility, but for the resident. They will come in and resolve any conflicts or issues that the resident was unable to resolve while in that long-term care facility. Now, again, if I haven't, welcome to your CNA certification class. While you're in this class, you're going to learn a lot of things. And we are doing this class based in the state of Michigan. So the state of Michigan set this program up, but the person who, the committee, I should say, or the organization who monitors this program is the Omnibus Budget Reconciliation Act, OBRA. So OBRA set minimum standards for you to follow. Even that introduction to long-term care was a minimum standard. So OBRA, OBRA is the acronym for Omnibus Budget Reconciliation Act. It sets minimum standards of training for the nurse assistant. They say that the nurse assistant must have at least 12 hours of in-service education every year. So when you work at a long-term care facility, even while you're working, they're going to give you 12 hours of education. It may be an hour a month. Hand washing month is January. Infectious disease or wound care month is February. Your responsibility is to show up, be present, and take the education. Because when you renew your certification, your state certification for nurse assistant, you need to prove you got those 12 hours a month. Okay. Now, working in a long-term care facility, we care about you as well as the residents. Please understand that. We don't want you to be abused, and we definitely don't want the residents to be abused, and we definitely don't want you to be accused of or be a part of abuse. You want to report sexual abuse. That sexual abuse is basically rubbing up against a resident inappropriately, or if they rub up against you inappropriately, stop what you're doing, get some help. You want to report any type of abuse, financial abuse, misappropriation of the resident's monies or funds. You want to report psychological abuse, and that's actually telling the resident, where are you going with that? You look crazy. That's psychological abuse. We would call it bullying in the real world or talking about somebody or bragging. You don't do that. That's inappropriate. This is her home. You came in to help her, make her look good, make her feel good. So we also want to make sure that you know that any abuse if you're accused of it, you're going to be taken off the unit, off the floor, and they're going to investigate. And once the investigation is over, you'll be returned to the unit because we take the residents' information and accusations very seriously. So if you feel you're being abused, you need to use your chain of command and also report abuse. Physical abuse, pushing, shoving, pinching, biting, all of that, that's not tolerated on the resident or on you. So they talk about military time. I would suggest you just practice military time. They have watches that can do military time, and we have a lot of information inside of your book in reference to the military time. It's pretty cool. It's pretty easy, and there's a lot of YouTube sites that you can click on and look at military time. So we also do incident reports in long-term care facility. So here, an incident report is any occurrence that is unusual. So if a patient reports abuse, that's an incident report. If a patient falls, that's an incident report. Anything that causes harm physically or psychologically, we'll do an incident report. So your responsibility is to let the nurse know and participate. Okay. All right. With chapter 2, they want you to be involved in the safety of the facility. If the floor is wet, put a sign up. If the patient has a broken bed, report immediately. When taking care of a resident in a long-term care facility, they also want you to be careful, be conscious, and be assertive. If the resident has difficulty with speaking and communication, the nurse assistant should speak slowly and clearly. Don't cover up your face or mouth. If you're wearing a mask, you have to speak slowly and clearly. If a resident has issues with hearing, they want you to take your time. Don't over-exaggerate the words. We want you to use your senses when you come to a long-term care facility. I mean, if you smell something, see it, check it out, address it. If you hear something, see it, check it out, address it. If you touch and it doesn't feel right, the resident's cold and clammy or her pulse is too fast, check it out, address it. The only sense you will not use is taste. We no longer taste our residents in the long-term care facility. Now, we want to avoid barriers to communication when working with our resident. A barrier to communication is anything that stops your message from getting through. So when I talk to Mrs. Jones and I want to know something, I'll use what we call an open-ended conversation or open-ended question. Mrs. Jones, did you go to the bathroom today? That allows her to answer the question. I wouldn't say, Mrs. Jones, you went to the bathroom, right? I wouldn't just tell her she went. I was performing in a way as a question. So that might not have been a good one. Let me see a better example. A better example would be, oh, Mrs. Jones, what did you hear? Did you hear something? What did you feel? Not, Mrs. Jones, did you hear that? Did you hear that bump sound? Because she might just say yes. I want to know what you heard. What did it sound like to you? I want to know what she felt. So use open-ended conversations. If your resident comes to you in pain, report to the nurse. The nurse has to immediately come and address pain, especially chest pain. If your resident comes to you and the resident is hurting, help the resident, sit them down and stay with the resident. Never leave the resident until the nurse comes. So let's talk about emergency situations. Okay, so an emergency situation occurs. Um, the first thing you're going to do is hit the call light and call out for help. Never leave your resident alone. If your resident has an issue with seizures, we don't touch the resident, put anything in their mouth. We make sure that they're safe. We lay the resident on the floor and we will allow the seizure to continue. Just make sure that they don't bump their head and they're not bouncing around.